歡迎大家出席今日嘅。
Welcome to the press briefing. With us today are Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of Center for Health Protection, and Dr. Larry Lee, Chief Manager, Hospital Authority. Dr. Chuang will first brief us on the cases. Good afternoon. Last night, we had 96 cases detected through PCR tests and 96 positive cases through RET tests. The total number of additional positive cases was 190. Of the 94 PCR positive tests, 18 were detected by DHA, 9 were detected by the Center for Health Protection, and 67 detected in private laboratories. Altogether, in the fifth wave of the epidemic, there were 1,197,000 cases, including 748,000 PCR positive tests and 449,270 RET positive cases. There were 28 imported cases, including 25 PCR positive tests and 3 RET positive cases. 19 were detected at the airport, including 10 arrivals who arrived in Hong Kong on the 21st. 9 travelers arrived in Hong Kong on the 22nd. Of those who arrived on the 21st, 4 flights were involved, 4 from SQ994, 2 from JL735. For the 9 arrivals on the 22nd, they were on board 6 flights, CX829, LX138, CI909, and TK070, 3 SK894, and 1 was on board EK384. Another 9 cases were detected at quarantine hotels. Most samples were provided from the 3rd to 7th days. We analyzed 108 samples at the public health laboratories. 104 were negative to L452R. 4 had very low viral loads. We did not see any new cases at residential care homes for the elderly. As for schools, there were 21 positive cases reported, 15 through RAT and 6 through PCR tests. Altogether, 20 schools were involved. There were a total of 19 students and 2 teachers and members of staff. In 3 of the schools, they saw 2 or more cases in the last 7 days, and in one of those schools, there were a total of 3 cases involving 1 teacher and 2 students across 2 classes. The teacher taught at both classes, and the 2 students did not know each other. The teacher last went to school on the 19th. We are currently monitoring the cases. There were no additional cases apart from these 3 individuals. In another school, 2 students who tested positive were from the same class and they sat close to each other. There were no positive cases among other students in the same class. There were 33 students altogether in that class, and they kept their masks on, save for eating and drinking, and their seats were divided by partitions, and we are monitoring the situation. No other RET positive cases were reported. Meanwhile, another school saw 2 positive cases among students across different classes, and the 2 students did not know each other. Among the fatalities, there were no newly reported fatalities by the hospital authority, so in the 5th wave, the fatality toll stands at 9,157. The crude fatality rate is similar to previous levels. In terms of premises, Earlier, a couple returned to Hong Kong from the US, and the sample on the 12th day was positive. We saw 3 cases that involve a McDonald's restaurant. We analyzed the 11 premises they visited, and we identified 2 further positive cases from the McDonald's at City Plaza. One is a 76-year-old female living in Regent Garden, Block 6, and on the 13th, from 11:30 to 12:45, she visited that McDonald's restaurant, and she sat at a round table at McCafe. 2 of her family members tested positive via RAT on the 18th, and on the 17th she had some coughing, and on the 18th her test sample came back positive. On the 19th of May, her building was subject to compulsory testing, and she provided a sample. She's now staying at North Lantau Hospital. During the infectious period, she visited a number of places, and they were now put under compulsory testing. These places included a restaurant called Malacca Cuisine in To Kwa Wan, and she visited at about 11 a.m. on the 16th, and on the 17th she visited the Fairwood restaurant at Bayview Center in Wan Chai. She had breakfast there on the 17th, and on the same day she had lunch at McDonald's restaurant at Ewell Street, and on May the 19th she went to To Hung restaurant at Hollywood Plaza of Mong Kok, and she had breakfast there at about 10 a.m. These places were included in compulsory testing. We would verify the time of visit and release the details soon. Another patient was a 67-year-old male who lives in Pun Yang Court, Block 6, Tai Kwu Shing. The case was detected through compulsory testing, and from 11 to 12 o'clock he visited the same McDonald's restaurant, and he sat at a small round table near the entrance. During the infectious period, he did not dine at any other restaurant. He was with his family at the McDonald's restaurant, and his family members were considered close contacts. Since we identified multiple cases in the same restaurant, we suspect a possible transmission arising from the previous couple. 5 other cases have been detected. We visited that McDonald's restaurant for investigation and sample taking. That's all for my report. Dr. Lee will now report the situation at the HA. Currently, 514 confirmed patients are staying with the HA. 45 were new cases. Of the patients sent to isolation facilities, 91 are in Tier 1 beds, 18 in second tier beds, 40 are in the North Lantau Hospital, Hong Kong Infection Control Center. 18 were newly confirmed COVID patients. As of yesterday, 2 patients were in critical condition. No newly reported critical cases were found. 10 patients are in critical conditions, 2 in serious condition. 3 patients in critical conditions are staying in ICUs. Yesterday, there were no newly reported fatalities. Yesterday, 43 patients recovered. 24 were discharged. Since the 5th wave started, 49,851 patients recovered, and some 45.9 thousand have been discharged. Since early 2020, 62,231 patients recovered. and 61,925 have been discharged from hospitals. Today, no newly reported cases arose from patients admitted to hospital. As for HA staff, some 23,000 staff tested positive. 22,892 have recovered and returned to their post. That's all for our report.
It's time for Q&A. Please raise your hand and use our microphone. Before you speak, please let us know the media organization you represent. First one, please. Thank you. I have two questions. Many experts said that for the fourth jab, not everybody needs it. So my question is, for the general public, what kind of criteria should be used to decide whether they need the fourth dose? Is there any concrete recommendation for them? Some rumors have it that there are doctors who charge a high fee for certification for the waiver of vaccination. So is there any sampling by the administration to do a check? Is there any way to stop such happening? Thank you. Under the CHP, we have scientific committee and also our expert panel together with the CE on the 20th of May. An online meeting was held. At that time, the latest scientific evidence and the local conditions were reviewed. All data show that in general, 3 doses of BioNTech and Sinovac are very effective in avoiding serious cases and fatality. So usually 3 doses are quite enough. But we know that there are individuals who are going to study abroad, or they need to satisfy the foreign countries' requirements, entry requirements. And some who are healthcare workers may be high-risk individuals. So they may choose to have a bit more protection. With the 4th dose, that would be a short-term and additional protection, but in general, that may not be necessary. We hope that 3 doses will be for the purpose of avoiding serious cases and fatality. But if people need additional protection, they can choose to get the 4th dose. So that is the view of the scientific committee. You mentioned a case about exemption certificates. Well, if there are breaches, I know that the relevant department and the bureau will follow up. Next, please, the lady on this side. Greetings, I'm from Hong Kong 01. My question is, for the 3-person household at McDonald, is it confirmed that the virus is BA 0.1.2, and then starting 23rd June, at designated health premises, the vaccine pass will be needed in order to get in? Some people said that this is too hasty a measure because there may be elders who need to have follow-up consultation. They may have to visit the hospital weekly, and they may not be very mobile. So if additional tests is required, that may be very inconvenient. So does CHP consider this a too hasty measure? What are some ways to help these people? Yesterday, there are reporters asking about the monkeypox. CHP believes that the risk of monkeypox in Hong Kong is not big. However, today, Belgium announced that those with monkeypox should be isolated for 21 days. If there is imported case in Hong Kong, will you consider such a long period of isolation, and what precautionary measures will be put in place? Thank you. Well, for the 3-person family, the whole gene analysis has not been done yet or has not been completed yet. Very soon there will be results available. At designated health premises, well, vaccine pass will be required. I believe it is there to protect hospital users, to make sure that they will not contract serious illness, and it is to avoid fatality as well. So users of those premises are the chronically ill and the elders, and members of the public are encouraged to take vaccination. If they do not have enough time to do that, they can do PCR test. I think it is very convenient to do that with the government. So we hope that people will get vaccination as soon as possible. Regarding monkeypox, today we are going to send letters to private doctors asking them to pay attention to the situation, and suspected cases should be reported. If there are suspected cases in Hong Kong, we believe that isolation will be needed because it is infectious. For length of isolation, well, that depends on the duration of incubation period, and 21 days will be quite normal. Next, that gentleman, please. Greetings. I want to follow up on Tai Kwu Shing. I am from cable TV. I want to talk about McDonald's in Tai Kwu Shing. For the newly confirmed case, well, did they sit quite close to the three-person family? And is there any ventilation problem? Is it true that perhaps the airflow is too strong, so it is easy for infection? We need to look into the seating distance. They have described how they're seated, but then we need to take a look on site and ask whether they can remember clearly where they're seated. They may not have very clear recollection. They just know that they are seated at a round table. So there are 2 newly confirmed patients together with the 3 confirmed ones earlier on. They are seated at a round table, but then are they close to each other? We have to check. For the lady in an earlier case, well, she's seated at not at a round table, but on a bench, high chair. So we need to take a look. Since the 5th wave, Omicron is highly infectious, especially if people don't wear masks. Usually, people will not wear masks when they're eating. So even though if air circulation is good, there will be spread of the virus. So we need to take a look. At early stage of the 5th wave, when we did quite thorough investigation, we realized that the virus can be spread even through a very long distance. Next, this gentleman, I'm from AM 730. Regarding McDonald's and Tai Kwu Shing, do you know the seat layout right now? For those round tables, well, are they on the route that people need to take when they leave the premises? Will there be some kind of relationship with a person from the U.S.? For those school cases, are those students seated at the front? And then was any teacher required to be quarantined? For earlier clusters or groups, are there any updates? And then regarding vaccination, when the government referred to 2 doses, there was no mention about the 3rd dose. And some members of the public are of the view that they don't want to get vaccination endlessly. So they don't want to take the 3rd dose for the time being. So is there any recommendation from CHP? Now we know that those patrons were seated at a round table. As regards which one, well, some said that the table was close to the entrance. Some said that the table was close to the food pickup counter. Well, of course, the entrance and the food pickup counter would be places where many people would pass by. So we have to look clearly at the seating and also the hygiene analysis. Okay, you refer to school. Which case are you referring to? For that one, the teacher was infected at an earlier date, and she did not go to school. Okay. On the 17th, the teacher did not attend school, and she had taught other 2 classes. And today, there was a case from those classes. One went back to the school on the 19th. That was their last day back to school. And on the 20th, they had one had positive finding on RAT, or both were RAT positive on the 20th. And so far, we do not need to ask any teacher or student to be quarantined.
之前嗰啲群組咧就冇再新增個。
We did not see any new cases among the previous clusters. Both local and overseas statistics show that after the first dose of a vaccine, whether it is Sinovac or BioNTech, it will effectively protect one against death or serious implications. And you can refer to these statistics online. For those above the age of 80, for the unvaccinated, fatality rate is around 17%. For those who receive 3 shots, the fatality is only 1.22%. And that is for individuals above the age of 80. And still, the percentage of this age cluster who received the 3rd shot is still very low. As for the other cluster, the crude death rate is 3% to, it will go from 3% to 0.04%. So for people who are yet to receive 3 shots, please do so as soon as possible. The gentleman on the back row, please. This is TVB. In terms of the trend of the pandemic, we see that we have about 190 new cases today. What is the CHP's assessment of the trend? Do you believe we are seeing a declining trend? For the 76-year-old female patient, what was her CT value? Was it high or low? She lived in Kwun Tong, but she visited different places and restaurants in different districts. So what is your assessment of the transmission risks arising from this case? If you have been following our recent figures, you can see that the daily caseload lingered from 200 to 300, and today we have less than 200, but we would not rule out further fluctuations. I would say that the pandemic has remained very stable, and various indicators, including statistics from sewage testing, statistics from community testing centers, show that the trend is rather stable and it is trending downwards. However, we might encounter various variants like BA.4, BA.5, BA.2.12.1, etc., and these might be rather transmissible. At this point, we do not expect serious complications, but earlier we did see transmission at Lan Kwai Fong Hotel. At the end of the day, Omicron is highly transmissible, and transmissions might arise in unexpected circumstances. And to this end, it's important to be fully vaccinated. Because full vaccination can prevent deaths or serious implications. For the 76-year-old female patient, her CT value was about 24, so transmission was possible. Next question. This is Now TV. For the 3 cases which saw new cases, can you give us more details, such as the region they belong to, or whether they were primary or secondary schools? the City Plaza McDonald's restaurant saw multiple cases. Was it because the restaurant was rather crowded, and do you expect further cases from that cluster? Finally, a question for the HA. The Li Ka-shing Charitable Foundation provided funding to allow some patients to be transferred to private hospitals, and what is the HA's plans on that? All three schools were primary schools located in Kowloon. Let me just confirm that. Yes, I believe that's the case. All three were primary schools in Kowloon. The McDonald's restaurant in question was a rather big outlet, and more than 100 patrons visited that restaurant that day. 20 or 30 individuals were recently infected, so around 100 patrons had to be tested. Some results are pending and some individuals are yet to be tested, so we would not rule out further infections. For the 10 other places, we are still following up and we have not seen any new cases yet. For the Li Ka-shing Foundation, we would like to express our gratitude and for the support offered by private hospitals during the difficult time. They admitted a large number of patients and helped with their treatment. More than 800 patients from public hospitals were referred to 7 private hospitals for treatment, including patients with coronary diseases, those with colorectal cancer, those who require radiotherapy services, and those who were expecting a baby. We will continue to work with private hospitals on this front. Next question, please. Good afternoon, this is Ming Pao. The LCSD announced a series of celebration activities for reunification anniversary, and some premises will be reopened. And with the announcement of these celebration activities increase the risk of infection, is this against the current anti-epidemic policy? Did the CHP offer any advice or recommendations on the hosting of these activities? I have some questions about earlier clusters. Yesterday, it was said that for the Benchmark Training Center cluster, one result was still pending. Is the result available now? And do you think the cases from this cluster have drawn to a close? Yesterday, we talked about a man returning from Singapore. Did his family members test positive? And at places he worked in or places he visited, did we see any new cases? For the 3 schools with new cases, apart from teachers and members of staff, would students from the same class be subject to certain limitations in terms of school activities, or, for instance, would they be barred from taking part in extracurricular activities for a certain period of time? For the Benchmark Training Center cluster, the result was negative. For cases that were subject to compulsory testing, we are still following up on them, and the compulsory testing is ongoing, and we are still waiting for the results. We did not see any new cases.
For schools with 2 cases or more, we are examining whether there are 2 cases within 7 days, this is already a very stringent requirement. We don't need students to do anything, of course, with the exception that they have to do RAT every day. Celebratory activities or events regarding reunification, well, all these events are related to crowd. So I believe that the relevant departments will put in place some anti-infection measures. Thank you. This is the end of the PC. Thank you.